The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone. Welcome to our webinar today. My name is Julie Bates. Thank you for joining our webinar on emerging trends related to tobacco use in Alaska. This presentation is a part of a series of webinars provided by the Alaska Division of Public Health, section of Chronic Disease Prevention and Health Promotion. This webinar series was created to provide a way for us to talk about our projects and explore ways that we can work together. Next slide. Before we start, there are a few housekeeping items to go over. If you are listening by phone, please keep it on mute. Please do not put this call on hold. If you receive a call, please hang up and call back in. The webinar is planned for 30 minutes. It's going to be a 20-minute presentation followed by 10 minutes of questions and answers. A recording of today's webinar will be sent to all participants in about a week, I'd say, and it will include all the slides and a link to the video. It will be made available soon. Next slide. The audio for this webinar will come through your computer or telephone. Please hold questions until the end of the presentation. Unless you have a technical difficulty hearing or seeing the webinar, then please let us know. Please hold questions until the end of the presentation. And to ask your question, you can type it into questions on the control panel. We can also unmute you and you can ask your question using either the microphone on your computer or with your phone if you called into the webinar. Just raise your hand by clicking on the hand button. Thank you again for joining us. Matthew Dungan, Program Evaluator for the Alaska Tobacco Prevention and Control Program, will now start the webinar.
Good afternoon. I just want to do one quick last audio check. Am I coming through loud and clear?
Sounds good.
Awesome. Thank you so much. So hi everyone, as was just said, my name is Matthew Dungan and I am the Epidemiology Specialist for the Tobacco Prevention and Control Program here for the state of Alaska. I'm grateful for the opportunity to present today. I just want to quickly highlight some of the objectives I wanted to review today. The first is unwritten. I'm going to try to keep this as interesting as possible so people don't fall asleep. But as I try to do that objective, I'll be reviewing the two main things I'll be reviewing today are Tobacco Facts 2022 and the Alaska Tobacco Quitline Annual Report. And as I review those reports, I'll be sharing key findings about nicotine and tobacco use in the state of Alaska. And then as we close today, after we've shared some of those key findings, I want to try to share some of the data gaps that we've identified and the steps we're taking to try to address those gaps and try to fill them. So whenever I introduce myself to people, they always ask what I do. And oftentimes I say I'm an epidemiologist and I collect and analyze data. And a lot of people ask, well, why are we collecting data? What do you do with it? And one of the key things to do with data is it helps us ensure accountability and demonstrate the effectiveness of the Tobacco Prevention and Control Program. And that data in turn helps inform program decisions. And it also informs decision makers' policy direction. So individuals like the legislature, cities, borough governments can use this data to help make policy decisions. Data is also important to help engage stakeholders. Anyone from nonprofit organizations to local citizens can all use our data to help with whatever effort they're trying to improve. And lastly, data helps us measure program-related effects. It helps us show that the Tobacco Prevention and Control Program is effective. It helps measure the scope of that. Now, there's two types of data that we collect. One is surveillance data. And we'll primarily focus on the tobacco facts aspect to address the surveillance data. And surveillance is the process of continuously monitoring things like behaviors, attitudes, health outcomes. In the case of tobacco prevention and control, it's monitoring what is being smoked, where is it being smoked, what people think about tobacco products. And then the second type of data that the Tobacco Prevention Control Program utilizes is known as evaluation data. In this case, it'll be the Quitline Annual Report. But evaluation data is defined as the systematic collection of information about activities, characteristics, and the results of a program, and is used to help make judgments about a program. It's also used to help understand how to better improve on a program's effectiveness, and can be also used to help make decisions. Evaluation data can help us see what's going well and also see areas that need further focus and evidence applied to it. So tobacco facts. So tobacco facts is an annual report that we put out, and it is intended to act as a resource for people working to support the health of Alaskans by reducing the harms from tobacco use initiation, such as nicotine dependence and secondhand smoke exposure. It also provides information that can be used to educate about the need for the continued efforts to reduce these harms. And it also helps those who are planning programs by helping provide them a strategic overview of tobacco use trends in different populations. And I'll emphasize that a little bit more here shortly. But just as an overview, Tobacco Facts is the most currently available tobacco nicotine use data among adults, among youth, and among pregnant women. And those results do attempt to show the toll on health and well-being that tobacco continues to have on Alaskans. I will emphasize this is the 2022 Tobacco Facts. However, sometimes data sources are a little bit, it takes a while to get them all lined up and ready to be used. And so the most currently available data in the 2022 edition of Tobacco Facts comes from 2020. Speaking of those data sources, Tobacco Facts has three primary sources of data. The first one being the Alaska Behavioral Risk Factor Surveillance System, also known as BRFIS. And BRFIS is a really cool survey. It's an anonymous telephone survey of adults 18 years of age or older. It is done in all 50 states and U.S. territories, sponsored by the CDC. And it is a primary source of information about a variety of adult health and related behaviors. Past BRFIS surveys have covered things like alcohol use, tobacco, obviously, physical activity, nutrition. But it just kind of tries to provide a snapshot of people's health behaviors across the nation. A second source of primary data is the Alaska Pregnancy Risk Assessment Monitoring System, also known as PRAMS. And PRAMS is a very, it's a survey near and dear to my heart. It's a survey that is given to newborn mothers. In Alaska, we manage to survey about 1 in every 6 live births. And it's a survey given to mothers. It discusses with them the maternal behaviors and experiences they've had. So certain questions like, did you get prenatal care? How was your birth experience? Did you feel like you were able to communicate with your provider and get adequate medical care? Was there any difficulty in your birth process? How's your child? How's your child's health? How are they developing? And all of this data is then collected, and the results are used to improve perinatal health programs in our state as well as across the The third type of data that is in Tobacco Facts, so the last data source we'll talk about for our surveillance system is the Alaska Youth Risk Behavior Survey, also known as YRBS. And this is a survey given to high school youth. So those are in 9th through 12th grade. It does require parental consent here in the state of Alaska, and it is anonymous and voluntary in nature. It is typically given during class and through a paper and pencil survey method, and is historically been done in the spring of odd years. And YRBS will ask lots of questions about use, like youth, if they drink alcohol regularly, how much they exercise, their nutrition, do they feel safe at school and at home, as well as questions about tobacco use and other related factors that have been connected to tobacco use. The most recently available data in Tobacco Facts that is from YRBS is from 2019. The 2021 YRBS survey was canceled due to the extreme challenges faced trying to conduct a survey in schools during the COVID-19. So we're looking forward to having the YRBS done in 2020. Now, before I start showing graphs and talking about data and trends and how the Tobacco Prevention Control Program uses this information, I wanted to talk about data and context. This report examines tobacco use among many different groups of Alaskans. There are observed differences in tobacco use and the harms between these groups, and those differences are the result of complex factors that, due to the nature of this presentation, we won't have a lot of time to dive into. These factors can be differences in where groups live, the incomes they earn, tobacco industry influence on that group of individuals, a lack of tobacco control policies that engage that specific community, and also an ever-changing U.S. population dynamic. In short, High tobacco use could indicate that it is more difficult for some groups of Alaskans to avoid tobacco use and quit successfully, rather than indicate that that group of individuals has less knowledge about the dangers of tobacco use or is less motivated to quit. So please, as we look at the data today, please keep in mind that tobacco use has different rates of prevalence in different groups of Alaskans, and it does not indicate that they are less knowledgeable or less interested in quitting than others. So for surveillance, the Tobacco Prevention and Control Program seeks to understand the big picture of tobacco in the state. And one of the biggest questions you can ask is how many Alaskans are using tobacco products? And from 2014 to 2020, the percentage of Alaskan adults who currently uses any tobacco has been steady. And in 2020, 26% of Alaskans reported any tobacco use, which includes cigarettes, electronic vapor products, and all forms of smokeless tobacco. So now the program is aware of, okay, this is the scope. 26% of all Alaskan adults report using tobacco. How does that look across different groups? Its surveillance data helps the program prioritize populations that face higher burdens from any tobacco product usage. We see here that at the top graph here, this bar graph shows 26% of adults use tobacco products. Alaskan Natives adults reported using tobacco products at 49%. Those that suffer from frequent mental distress, 34%. Men are more likely to smoke than women at 30%. And tobacco use, I apologize, men are more likely to use any tobacco product. And those that are younger are also more likely to use any tobacco product than those who are. So now we know the general scope. We know that tobacco use does vary among different groups, and there's many reasons why that could be. We also need to know, is there a geographical difference in where people use tobacco products? And so we do surveillance analysis to figure that out using surveys. And we know that the percentage of Alaskan adults who used any tobacco product does vary by region. We see here that tobacco use in the Southwest and Northern regions is significantly higher than in all other regions. And the Tobacco Prevention Control Program is looking into ways to address that. But now we also know where we need to try to spend some of our efforts to try to help address that disparity. Now we have a general idea about tobacco use, the amount in the state. It does vary by groups. It also varies geographically. Why don't we look at a particular smoking product? Let's look at cigarettes. The percentage of Alaskan adults who smoke has dropped significantly since 1997. We see here the blue line represents Alaska, the dashed green line represents the US average. And in 97, 27% of Alaskan adults smoked, while 25% of adults in the United States did. Now in 2020, the most currently available data we have, 19% of Alaskan adults smoke. However, the national average has dropped to 13%. So we can see there's been a dramatic improvement in this time period. However, there's still obviously room to improve, help people continue to quit smoking. Now, we have a general idea about about smoking and general tobacco products. Another surveillance thing that is of importance to the program is understanding people's behaviors and attitudes. How often do smokers want to quit? And in 2020, our survey indicated that half of all Alaskan adults who smoked made a quit attempt. So 57% of adult smokers in Alaska tried to quit in 2020. And that has been a relatively stable metric since 2011. So that indicates that even over time, the desire to quit is pretty stable and pretty consistent. Is that the case, though, among different groups of Alaskans? And the answer is yes. In 2020, attempts to quit were relatively uniform across different groups of Alaskan adult smokers. It doesn't matter if you suffer from mental distress, if you're a man or a woman, your desire to quit smoking is very similar. The only caveat here on this graph is that in this case, age did make a slight difference. Those that were younger reported having a higher desire and were more likely to try to quit than those that were. So this is very interesting information. We know that smoking rates are different, but the desire to quit is really uniform, and it is relatively high. Almost 60% of all adult smokers want to quit. We do know that healthcare providers play a critical role in helping people quit. In this case, 72% of all adults who smoke reported who had seen, I'm sorry, of those that smoked and saw a medical provider, 72% were advised to quit smoking. That is very important information to know, because we know healthcare providers can play a key role in helping someone quit. Now, we've talked about surveillance data. I'm now going to take a moment and turn to evaluation data. And the evaluation data is going to come from the Alaska Tobacco Quit Line Annual Report. And the Quit Line is a free service available to all Alaskans across the state. And it is based off of research. We do know that quit lines have been shown to be an effective way to quit smoking. And also, I would like to emphasize that the Tobacco Facts Report contains data most recently to 2020. This contains data of just those who called the quit line from July of 2021 to June of 2020. And this report seeks to summarize the services provided by the Alaska Tobacco Quit Line. It also helps us try to understand as a program what the number of services were provided, if those service patterns are changing, and help us evaluate the success of promotional activities. So we look at some of the data, and in the last fiscal year, 150 adults on average enrolled in the quit. We see here that it is somewhat cyclical, and there are some ebbs and flows. Typically, traditionally in Alaska, quit line calls have dropped in the summer months. There's lots of subsistence activities, fishing. Frankly, summer is a glorious time to be in Alaska. Not a lot of people are on the phone. However, we see in the winter months, things start to trend upwards a bit as people begin to reflect on the end of the year, their New Year's resolutions. Quitting smoking is a very common resolution. People want to improve their health. So we do tend to see an increase in calls. So we now know roughly when people enroll and how many people enroll. And in this fiscal year, just under 1,800 individuals enrolled, 1,796 to be exact. How did they enroll in the quit line? There's many different ways to do it. You can call, there's websites, there's a provider referral system. You can also text on your phone to enroll. Well, it's a program. We seek to understand how people engage with it. Are there things we can do to improve the process? And we can see here that Alaskans tend to prefer phone enrollment and provider referrals. So that tells us that Alaskans typically tend to self-enroll themselves by calling, or they talk to their provider and the provider is like, hey, let me fill out this referral form. I'll send it to the quit line and they'll contact you. When people do enroll, we were curious what services they're using. They can either use a phone service, which can either be a one-time call or multiple calls with also access to medication to help with cravings. They can involve themselves in a web program, which involves web-based counseling, emails. They also can get access to medication for that, for cravings. And then there's individual services, which are more a la carte in a way. They can sign up for text messages, emails. They can get a quit guide mailed to them. They can get a small supply of medication to see how that helps with their cravings. Individual services is very popular for those who are maybe just starting to quit for the first time. They're trying to test things out and see what works for them. The program is also interested to know how people hear about it. The program spends a great deal of time and effort doing media messages and doing healthcare provider outreach. And we can see here that the two most popular ways that people use or hear about the quit line is through their healthcare provider or their media messages. And that lets us know that these are effective avenues. And we can try to find ways to maximize their utility and efficiency of those efforts. I know we're running short on time for the Q&A, so I'm trying to get through this and still be coherent, so please bear with me. We also look at the demographics data. More women than men used the quit line in the last fiscal year, 53% of women to 47% men, which does match the national trend where women are more likely to use the quit line than men are. We also look at the programs. There are a couple different programs. The standard program has 5 calls, 5 coaching calls, and limited inbound calls. So if someone is having a hard time with a craving, they are able to call at any time. But there are usually 5 scheduled coaching calls where a coach will work with you on techniques to help deal with the stress and the cravings and help just make plans to successfully quit. We do offer enhanced programs for those that might have a mental health condition, which has been shown to make it a little bit more challenging to quit. And a pregnancy program for women who are pregnant or planning to become pregnant who are seeking to quit any tobacco product. The Alaska Tobacco Prevention and Control Program is also working to evaluate and improve quitline services to increase our ability to reach Alaska Native people. This chart shows, using the orange dashed line, the total enrollments in that monthly period. The blue line shows the number of individuals who identified as Alaska Natives who enrolled in that month as well. 34% of Alaskan adults who smoke cigarettes identify as an Alaskan Native or an American Indian. However, only 17% of quitline enrollees in fiscal year 21 identified as Alaskan Native. There is work to be done to try to help improve that, and the program is seeking to do that. We've now talked about the surveillance data and how we use it to get a picture, and we looked at evaluation data to see how our program, how effective it is, and how we can make it better. There's things we don't know. We don't know the barriers that Alaskans face when using the quitline. Those are probably also different for rural versus non-rural individuals. We also seek to understand, is the quitline working for Alaskans, and what are their perspectives about quitline? We also seek to understand what services Alaskans want to use the quitline. Do they like the quitline on its own? Do they prefer a local cessation service? Would they prefer a blend of both, where they're able to access both as needed? And if they do use the quitline, do they prefer a phone counseling or an online counseling system? And when it comes to medical providers, a key tool in helping people quit, what type of providers are asking about smoking? Is it just nurses? Are dentists doing it? And if they are asking, how effective is that recommendation? To address some of those questions, we've developed the online adult tobacco survey. We were able to survey 2,400 respondents this summer actually, and we seek to answer some of those questions and fill in those data gaps. And we look to have those results in early 2023. And if I haven't bored everyone to death, perhaps I'll be invited back. And lastly, we've also launched a quitline callback survey. We had almost 1,800 people call us last year. How did it go? We typically do these surveys every 5 years, and the last one was in 2018. They're very costly, they're very time intensive, so we can't do them super frequently. But last time we did it, it showed that the quitline was very effective with its quit rates. However, now we're seeking to understand, did people like their coach? Was it effective? Would they prefer phone over online coaching? Were they successful? What was their quit rate success? Pros and cons, what did they like? What did they not like? Would they recommend the quitline to others? Do they have any suggestions to help make it better, more applicable to them and people like them? Before I open it up to questions in the time we have remaining, I'd like to make some thank yous and acknowledgments to the major contributors for the development of tobacco facts, those in the section of chronic disease prevention and health promotion, as well as the individuals from the tax division, and also those from program design and evaluation services based out of Oregon, who also played a major role in the Alaska Tobacco Quitline Annual. Many thanks to them, especially Julie Dilly and her fantastic group of individuals. Lastly, this was very quick. I could not cover all the data, especially for those for youth and pregnant and other groups of Alaskans. If you have questions or you'd like to learn more, please feel free to reach out to me. I'd be more than happy to talk to you and help share what we know. And at this point, I will stop talking and see if there's any questions.
Thank you so much, Matthew. I don't see any questions coming in. Arthur will also help us look for questions here.
I think I put everyone to sleep.
No, I see one. I just have to figure out how to look at it.
So we have 2 questions in so far. First one is, can you please send the presentation and the web links in the email? I believe you said before that all that stuff will be provided, right?
Yeah, it might take a week to get it out to you, but I will definitely send a link to the video and then a PDF copy of the slides.
Yeah. And then the next question we have is, why did it take so long to get the disparity numbers? This was asked by Tia. For Alaska natives versus non-natives.
So we update that data every year. And so in this case, it just takes time for the BRFIS does their survey, and then the BRFIS folks have to analyze and clean the data. And so we're typically about 2 years behind, but we do typically emphasize that we do look into those groups, those with mental health conditions, gender, and lots of other different groups as well. So I believe the link to the 2021 tobacco facts will also have that information. don't know if that answered Tia's question. I can't see the chat, so I'm just having to rely on you there. So.
Yeah, so it looks like Tia has a question. She said that she's been waiting for 7 years to get the disparity numbers. And so I'll just put your email in the chat, and maybe she can reach out to you. Or Tia, if you want to send your email to me directly, or I can grab it from the from your sign up, and I'll send it on to Matthew.
Yeah, I'd be happy to share with you. It is on our website, I believe. So, however, the 2022 tobacco facts, we're really close to getting that published. We just have to do some accessibility reviews. And so that might take a little bit of time, but we just want to make sure everybody can access our data. Once that's up, I think we're going to probably send out a GovX notice so that everybody knows, or Gov delivery.
Next question we have is, a lot of your slides refer to smoking. Is that data exclusive to smoking? In Southwest Alaska, we have high prevalence of smokeless tobacco use.
Yes, that is true. And today, I only had 20 minutes, so there was a lot to cover. So I was only able to focus on like general tobacco use and then smoking in particular. But another report that we do put out is regional profiles. So that might be of interest for this, I believe you said Southwest individual here. But we do have data on tobacco facts that shows it across the state. And then we do try to do a breakout regionally that kind of goes into a bit more detail about tobacco, smokeless, vaping on that regional level. We're not able to go much smaller than regional because we maintain data integrity. Privacy with some of the survey response is, but we do have that available. I wish I could see more questions. I'm sorry.
Yeah, no, that looks like about it. I will really quick, I'll grab the most recent tobacco facts and put it in here for you folks. If I can find it really quick. And I'll also send that out when I send the link to the video.
Thank you so much.
Yeah, no worries. So this is the link for the 2021, and 2022 will be coming out very shortly. Well, great. So if we don't have any more questions, thank you so much for presenting today, Matthew. We really appreciate the information.
Thank you all for coming, and thank you for the questions. Once again, if you have any other questions you'd like to ask, please feel free to email me so I can try to help address those questions and share what we know.
Awesome. Well, thank you again for coming, folks. We'll see you at the next one.
Take care.